screen. Yeah. I am Dr. Hanjam Barun Sharma. Thank you very much for giving me this opportunity. Let's begin the talk. So, clinical and interventional physiology, they form the basis upon which, pharmacological therapy as well as surgery is done. And the CIP, they basically deals with the use of different physiological intervention like exercise, nutrition for health and fitness promotion and maintenance, as well as illness and injury prevention, treatment, rehabilitation, etc. And sports and exercise medicine is one of the sub-branch or subspecialty of the CIP, and exercise is medicine is also one of the subspecialty, as well as functional medicine and lifestyle medicine are also the different form. They are also the different specialty, subspecialty of the CIP. Let's focus on sports and exercise medicine, which is just an application of sports and exercise medicine, which the main focus is on CITES, ALTIES, FORTIES, that is faster, higher, and stronger. And the ultimate purpose of sports medicine is improvement of the optimization of the human and sports performance, dop-free human and sports performance with the minimization of the injury and illness. And the foundation is formed by performance-related sports and exercise physiology, whereas in case of the exercise medicine, the ultimate aim is use of the physical activity and sports for fitness and health promotion and maintenance, as well as therapeutic use of physical activity and exercise for illness and injury treatment and management, including non-communicable disease. And this foundation is formed by clinical exercise physiology. So in sports medicine, we deals with 6 patient, from healthy patient to amateur to elite player, and it is just an application for of clinical application for sports and exercise physiology. And for optimization of the performance, one has to understand the moderator, the important role of the fitness, because the internal and external load is modified by this moderator, whether they can lead to, say, a physiological maladaptation or pathology or illness or injury or positive adaptation. It is divided. It is decided by the moderator, because ultimate aim is what? Dop-free performance enhancement with the injury and the illness minimized. And that's why we have to understand the different type of physical fitness, like for example, health related cardiorespiratory endurance, body composition, muscle strength, endurance, flexibility, or agility, coordination, balance, power, reaction time, speed. And each component can be targeted by a well designed exercise intervention. That's why we have to understand the physiological intervention in the form of exercise training or exercise prescription under sports medicine or exercise medicine. And for the principle of the exercise training is very important. It has to be specific demand to the imposed demand, and progressive overload accompanied with the sufficient recovery. Or if you remove the physiological load, then what will happen? Whatever benefit you gain will be lost. This is the principle of the reversibility, or the training intensity and the technique has to be varied depending upon the requirement or phases of the training, like preparation phase or competition phase. This is the principle of the variation of periodization, and everything has to be individualized and law of diminishing return. Then that means if you give the same amount of training to a novice or amateur player as compared to the elite player, the adaptation will be higher in case of the amateur player. This is important. Another point is the exercise prescription. You have to follow the fit BP, frequency, intensity, time, duration of exercise, type of the exercise, volume, progression, and pattern of exercise. And apart from the six point, you have to understand when to give the exercise. That is according to the circadian rhythm. That is chrono exercise. And exercise can be aerobic, resistant, flexibility, depending upon the smart goal. There is specific, measurable, attainable, realistic, and time bound. This such type of the exercise prescription which you have to do. And why this is important? Because if you do under training, then what will happen? Physiological adaptation will not occur and sub performance will be there. But if you give overtraining, then overtraining syndrome, physiological maladaptation will occur, and overtraining syndrome will happen. Or if it is accompanied with low energy availability, then RESD or REDS, that is relative energy deficiency in sports, or a female athlete triad can happen. So our aim is to achieve the overreaching, where optimum physiological adaptation or physiological super compensation happens, and avoid this two phase. And that's why monitoring is very important. Monitoring can be done in the form of electrophysiological or different physiological parameter like HRV, or it may be done by using different biochemical parameter like say a testosterone by cortisol ratio or so. And going into the terminology of the different exercise intensity, it can be of say very light, moderate, vigorous, or near maximum, depending upon say percentage of the VO2 max, or it may be because of the metabolic divided or based upon metabolic threshold 1 and 2. One is anaerobic threshold, 2 is a respiratory compensation point, and in between is a zone 2, and this is zone 1. So different zone can be divided, or it may be based upon a rating of perceived exertion on Borg scale, like from 6 to 20, or modified Borg scale from 0 to 10. All these things. And high intensity interval training exercise can be designed with focusing on the higher intensity side, or sprint interval training on a very high side. And these are the different physiological stress. So and depending upon that, different adaptation can occur. So all this thing is important. Like for example, here you can see that by using a gas analyzer, this is the anaerobic threshold, that is ventilatory, metabolic threshold 1, and this is a metabolic threshold 2, that is respiratory compensation point. In between is a isocapnic buffering, IB, and beyond the respiratory compensation point is the HHB, that is the hypocapnic hyperventilation. And if you don't have the this gas analyzer, simply by using the percentage of HR max, you can divide into different exercise intensity, like less than 57, 57, 64, 77, 96, 96, or a percentage of VO2, 37, 46, 64, 91, 91. And different, the energy system can be targeted by using different exercise heart rate, like phosphagen system, anaerobic glycolytic system, or aerobic system, like 55 to, or 60 to 90% of HR max. You can target the aerobic system, and maximum heart rate can be calculated by using the formula 208 minus 0.7 into as in year. Or these are the important point. And why aerobic fitness is important? Because the more aerobic fitness means, the less will be the relative risk for injury. And based upon this, we have published different papers, not only on players but also on, say, type 2 diabetic males. And here you can see that this is the graph, and in the y-axis is the percentage body fat. So everything is negatively correlated, and this is the red line is a VO2 max, negatively correlated. This is the black line. Black line is HSV, that is hypocapnic hyperventilation, 80 anaerobic threshold. Blue line, green line is a RC, respiratory compensation point. Here in the this graph is in the x-axis. This is the exercise duration. Everything is positively related. Like for example, blue line is IB, that is IB is the isocapnic buffering. Red line is the VO2 max. Green line is the RC, respiratory compensation point, and black line is the HSB, hypocapnic hyperventilation. And also the VO, this is the x-axis, the VO2 max. This is also positively related with different parameter for HRV, like for example RMSSD, red line, and this is the SD1, this is the green line. So in this way, it can be can be used for different monitoring purpose. And again, for a diabetic patient also, you can see that this is a red line, is a red is a diabetic, this is the blue is the healthy control male, and you can see that diabetic has a significantly lower VO2 max and and heart rate recovery. And this significant difference of VO2 max is still maintained when you control for the difference in body composition. That is over and above the difference in body composition, there is significantly lower VO2 max among the diabetic. This one has to understand. And also, there is an inverse relationship between the glucose control. That is, there is in x-axis is the SbA1c with the VO2 max, red line, or with the 6-minute walk distance is the blue line. That is the functional cardiorespiratory fitness parameter in the form of the 6-minute walk test, or VO2 max, is inversely proportional with the HbA1c, that is glucose control. This thing one has to understand. And again, going into the different clinical exercise testing, you can see that depending upon the different organ system affecting different diseases, can have a different, pattern of affecting the exercise limitation. Like for example, obesity, occlusion, or say hypertension, thromboembolism, everything can be affected. Exercise, limitation based upon affecting a particular organ. It may be ventilatory, it may be circulatory system, or it may be muscular system, based upon a fixed principle or fixed equation. Like for example, by using this a simple flowchart, you can find out which system is affecting the exercise limitation. Like pick VO2 max. If it is low, then you see the anaerobic threshold. If the anaerobic threshold is normal, you see the bleeding reserve. If the bleeding reserve is normal, it is because of the ventilatory impairment. If the bleeding reserve is normal, then it may be poor effort decongestion, or even it may be coronary disease. If the anaerobic threshold is low, then you see the breathing reserve. If it is normal, then it is because of circulatory impairment. If it is is low, then it is because of the cardiorespiratory problem, mixed lesion. So in this way, you can easily predict what is the reason for exercise prediction. Similarly, different algorithm has been published. We will not go into the detail. And and the most common form of the exercise therapy, exercise prescription, which is given in order to improve the exercise cardiorespiratory endurance, is running. And running has a different pattern. Like, for example, this is the forefoot rear foot strike running, where striking by heel. And again, this is the the another type is the forefoot or mid foot strike, which is also known as non rear foot strike. And when you see the vertical ground reaction, you can see that in case of the rear foot strike, this loading rate is very high, slope is very high, whereas there is presence of the impact peak, and as compared to the non rear foot strike. Because of that, different injury profile can happen, because vertical ground reaction, it's also depend upon the speed also. Like, for example, running can be associated with 2.2 times of your body weight. And all your musculoskeletal soft tissue system will be subjected to this much of force. And depending upon that, the injury profile may be different. Like, for example, knee injury, like MTSS, medial tibial stress syndrome, back injury, it may be more in case of the rear foot strike, whereas metatarsals or Achilles tendon problem can be there in case of the non-rear foot strike. This one has to understand. However, the metabolic net metabolic rate or metabolic efficiency may be same in both type of the running form. And also, running efficiency analysis is very important, because this is one of the key factor for performance, in case of the exercise and sports lab. The analysis has to be done. And different force strengthening, depending upon a force exerted, different muscle strengthening program is also important for running. Like, for example, gluteus maximus can exert up to say 0.4 to 2.8 times of body weight during the running. This thing one has to understand. And another point which one has to understand is the running to target the fat burning, that is known as fat max zone. This fat max zone is a maximum oxidation of the fat happens around this zone, which is approximately equal to 55 to 72% of VO2 max intensity. And why? Because of the say in normal subject, when you increase the exercise intensity more than 65%, then the amount of the energy contribution from the fat decreases significantly, whereas the dependency on a carbohydrate increases. But however, if the particular individual is a fat adapted or keto adapted, then this crossover point will shifted on the right side. This one has to understand. So if you want to target the fat burning, then your intensity has to be little bit lower in case of the carb burner. Therefore, methadone running and slow running technique is based on this principle, where the running heart rate is kept around 180 minus s, so that a relative, they want to target, the fat burning zone. And also, depending upon the type of the fuel used during the exercise, one has to know which type of exercise has to be prescribed for say diabetic. Like, for example, glucose oxidation can be up to 2 gram per minute, and fat oxidation can be similar in case of the highly fat adapted individual. Like, muscle uptake can be up to 5 times during rest, during times of the rest during the heavy aerobic exercise. Therefore, the aerobic exercise can be effective therapy for reducing the glucose spike, or it may be associated with hypoglycemia. But however, if you do high intensity exercise, then hyperglycemia can occur in case of the diabetic, because up to 10 times of 10 times of the glucose liver glucose production can happen. Because ultimately one has to understand that normally only 4 gram of glucose is present in our circulation. So a strict control is there. But depending upon a fuel used for type 2 diabetic, we have to design a different exercise prescription zone for effective glucose control, as well as avoiding hypoglycemia and hyperglycemia. And a simple EMG based exercise prescription is the glucose soleus push up. Why EMG is used? Because we want to make sure only soleus is contracting, not the gastrocnemius, because soleus is present 1% of the body weight, but it is fatigue resistant. That is, you will be able to do this exercise for a very long time. And the important point is there is the see amount of the oxygen consumption is very very high, and also the reduction in glucose and the insulin by doing this simple exercise is very very high, and improvement in a VLDL and triglyceride is also very very good. That's why this type of exercise, simple exercise, is very much effective for type 2 diabetic, or say diabetes patient, or metabolic abnormality patient. And similarly, EMG based exercise technique can be used for designing different exercise equipment. Like for example, here in the say in the same weight is being lowered, then eccentric contraction of the quadricep happen. And when the eccentric contraction happen, as compared to the concentric contraction, the surface EMG interference pattern decreases. This decreases is because, why this decreases? Because same weight is there. This is based upon the principle of the force velocity relationship. I will not go into the detail, but if you don't want this reduction in surface EMG, then you have to increase the weight during the eccentric component. How much weight you have to increase? Approximately around 1.5 times of the load which you use during the concentric phase. Then only 30% higher drive will be there, and this EMG, surface EMG recruitment, of the muscle fiber will be there. And this recruitment is important for optimum loading of the muscle, so that adequate hypertrophy happen. That's why variable resistance training you can design based upon your knowledge of the exercise physiology and the EMG based exercise physiology research. Going again to the biomechanical based exercise prescription, here you can see this is a butt wing. This is known as butt wing. It may be because of the tight hamstring, or it may be because of the say lower ankle mobility. So just by assessing all this thing, muscle imbalance and all this thing, goniometer, this thing, the angle, you can easily modify the exercise, and you can easily correct the incorrect exercise which may be associated with the injury risks. Similarly, biomechanical consideration one can use, if you during the squatting, if your knee is very much away from your ahead of your toe, say more than say 15 to 20 centimeter, then much stress will be there on the knee. It may lead to knee pain, or if the patient is already suffering from knee pain, this type of exercise may be problematic. Like for example, in such a patient, such type of exercise is associated with the knee stress. Therefore, a stool can be inserted where the stress from the knee can be relieved. But however, in this position, the stress will be higher in case of the hip joint and the back joint. So based upon the requirement, you can modify the exercise. This thing, like for example, here you can see that this is the red line is the moment arm. That is the perpendicular distance from the axis of rotation to the the line of the force. This is very high. That means the torque will be high here, the load will be the torque will be high, and the stress will be more on the hip joint and the lower back pain as compared to the knee joint. Here in case of the knee joint, the momentum is more, therefore in this position knee stress will be high. So depending upon a requirement, we can easily modify the exercise. Like here, the more it will be more challenging to the hip joint, and it will be less challenging to the hip joint. So modification of the exercise regimen, we get, this is a back squat, this is a split squat, and similarly we can we can see modify the exercise in case of the say a hip pain. Like for example, FAIS, that is femoral acetabular impingement syndrome. Like for example, by using a trap bar deadlift, we can lessen the challenges to the hip joint, when especially when hip pain is present. Why this is important? Because you can see that by using a trap a trap bar deadlift, this momentum, this momentum is significantly decreases. That's why the torque and stress on the hip joint is decreases as compared to to this one. And again, strength curve based training is also important, where this is a strength curve, a range of motion, and this is isometric torque, and a maximum force, maximum isometric torque can happen at a particular optimum angle, which is approximately equal to 70 to 120 degree for elbow flexion, that is bicep. For tricep, it is 90 to 120 degree. And strength curve can be measured by using this instrument which we designed, we have applied patent for, and this practical has been used as a part of the PG as well as UG practical at AIMS Delhi. and different exercise pattern has different strength curve. Like for example, descending strength curve is there for this type of exercise, where initial at the starting of exercise, your body is able to exert produce more force as compared to the end of the exercise. And this is the another one, this is the ascending type of the exercise curve, where your body is able to produce less force at the starting of exercise. Like for example, here in this bench press, this by just hanging a chain, initially the chain weight is supported by the floor, but when your extension is there, then the whole of the chain weight is added to this part. That means when you are able to lift more weight, the whole weight of the chain is added. This lead to optimum loading of the muscle, and in this way, proper training can be done. Similarly, for squatting, resistant band squatting is also effective. But the point here is it is also important where the injury happens. See, tearing of the pectoralis happen at this point where the body is not able to produce more force, and eccentric contraction happens. This is known as taking point reason. So in this way, exercise modification and injury prediction, injury prevention can happen. Another point which we want to understand is the strength concept of the muscle centric medicine, because with increasing as dynapenia and sarcopenia will happen, decrease in muscle mass, decrease in muscle force will happen, and it will be replaced by adipose tissue. And appropriate use of the exercise, resistance exercise, and lifestyle and nutrition is very important in the form of the MICMA, that is muscle centric medical approach. This is very important because and one has to understand that hand grip, simple hand grip strength was more important for predicting cardiovascular mortality than even blood pressure. And you can see that in the athlete where proper training is done, young and older, they older individual, they have preserve insulin sensitivity, that is insulin mediated glucose uptake is preserved. And muscle is the organ for high longevity, whereas fat is the organ for inflammation. And see, fall is very very prevalent with increasing age, and 90% of the hip fracture is because of the fall, which and out of which 20% are fatal. This one has to understand. This is very important in the case of the Indian, where visceral adiposity with the thin muscle mass is highly prevalent. Asian Indian phenotype. This is known as toffee, where is the thin outside, where the fat inside. The fat is deposited in a visceral tissue, and because of this, pre-diabetic and diabetic is very much prevalent in India. And anaerobic and muscular fitness, it is important because the fitness, muscle strength, more muscle strength is related with less chance of the injury. And here you can see that the strength training is associated with so much reduction in injury. And these are the different paper we have published, and also associated with anaerobic testing, wind gate testing. These are the different paper we have published. This is the one booklet on stretching. And also another important point is muscle imbalance based exercise training is also important, where you can use by using different, say, isokinetic dynamometer, where you can find out the ratio between the hamstring and the quadricep, which is in the form of the HQ strength. And the more a hamstring strength is there, then more stability will be there, especially in the relationship with the ACL. Therefore, protection against the ACL tear is there. And similarly, if weakness of the gluteus medius is there, then tightness of the quadriceps lumborum can happen, and it may be associated with the low back pain. And similarly, gluteus medius weakness can lead to the, say, valgus, knee valgus, or knock knee, and what you call the hip adduction, internal rotation of the femur, internal rotation of the tibia, and foot pronation can happen, which may be associated with a different injury profile, or it may be it may be associated with the tibial external rotation also. And this position is basically important because this is a position which is associated with the ACL tear, and therefore training regarding gluteus medius, hamstring, quadricep, all these things, jumping, landing training is very much important if you want to protect against the ACL tear. And muscle imbalance based exercise training, one point is also one has to understand the PNF stretching also based upon a principle of autogenic inhibition and reciprocal inhibition. Autogenic inhibition is the inhibition because of the Golgi tendon organ, and reciprocal inhibition is the activation of the antagonist lead to the relaxation of the agonist muscle. Like for example, hamstring muscle, you can see that if you do isometric contraction of the hamstring, then GTO, Golgi tendon organ, will be activated and a relaxation can occur. This is the whole relax PNF stretching. hamstring, and if you do the isotonic contraction of the hamstring, then relaxation can occur, or the contraction of the quadricep, then relaxation of the hamstring can occur. These are the different form of the PNF stretching. And similarly, this autogenic inhibition and the reciprocal inhibition principle can be used for muscle energy technique, where it can be used to for relaxation of, say, hip external rotator, or say iliopsoas muscle, or say quadricep muscle, which are associated with a different problematic, or it can be used for, say, exercise associated muscle cramp, like for example cramp of the calf muscle, or cramp of the quadricep muscle, which may be associated with fatigue, which lead to more muscle spindle activity, or say inhibition of the Golgi tendon, which can be reversed by using stretching. And another point which one has to understand is eccentric exercise, where mechanotransduction plays an important role. Because of this eccentric exercise, sliding of the collagen lead to protein synthesis, and this is important when you are dealing with degenerative condition, like for example tendinopathy, like adductor tendinopathy. You can use Copenhagen adductor exercise, or Nordic hamstring curl for Nordic hamstring tendinopathy, or decline board squatting for patellar tendinopathy, or for, say, Alfredson Hillthrop exercise for, say, mid insertion Achilles tendinopathy. And manipulation of the physiology is also one point where you can maintain the muscle atrophy by increasing, say, metabolic stress. If you are not able to increase the mechanical tension, like for example in case of the injury, like here you can simply increase the metabolic stress by just occluding the venous outflow. If you occlude the venous outflow, then metabolic stress will be increased, and because of this increase, then muscle hypertrophy can be maintained. It can be used during isotonic exercise, or isometric hold, or aerobic exercise. Like for example here in this experiment, you can see that the decrease in cross-sectional area is maintained in experimental group, where you use this BFR training by using in case of the post ACL reconstruction patient where the knee is immobilized in brace. This thing one has to understand. This BFR workshop was performed, which we did in our society conference in 2022 March. And similar manipulation of the physiology can happen if you stimulate the neural pathway, if you prime the neural pathway which is responsible for the muscle contraction. It can be done by, say, mental imagery or training. It can be done by, say, post activation potentiation, like for example if you do maximal voluntary contraction just before your activity, then your performance, your force production will be improved, just like a beneficial effect. This is because of the phosphorylation of the myosin regulatory light chain. This is known as PEP, that is post activation potentiation. If the performance enhancement it is maintained for more than 1 minute, then it is known as post activation performance enhancement. Or the enhancement in performance can be done by directly stimulation of this pathway by using transcranial direct current stimulation, cathodal or anodal. Enhanced performance enhancement can be achieved. This comes under what is known as neurodoping. This is just a principle of what we generally use during the intraoperative neurophysiology, neuromapping. Like for example, motor mapping, we stimulate the motor cortex and record from the muscle. Similar principle is there. And last point which I want to make is the use of the exercise as a medicine. Exercise is associated with so much beneficial effect that exercise can be used as a medicine. Like for example, cardiac disease, 40% reduction is there by using exercise, whereas drug and surgery, 24% reduction is there with statin. For type 2 diabetes, 58% incidence reduction is there with exercise, whereas for with metformin only 31%. Therefore, exercise has an important role, and our society has a leading role to play in the formation of exercise in medicine in India. It is a national center for imparting the knowledge of the exercise, use of the exercise as and physical activity, as a medicine, and we will be working in collaboration with the exercise medicine under American College of Sports Medicine. And lastly, which I want to focus is regarding the COVID-19 and myocarditis, because 25% of the sudden cardiac death can happen because of the myocarditis. This one has to understand. And the symptoms of the mild or early subacute stage of myocarditis may be confused with the overtraining syndrome, which are present among the athlete. But the point is, if it is a diagnosed myocarditis, then at least 6 months of no sports should be there. And for pericarditis, at least 3 months of no sports should be there. And this is a detailed guideline which our society has published regarding COVID-19 and return to the activity. And the point which I want to make is, sports and exercise physiology is a basis for everything. And the ultimate aim is achieving the physiological positive adaptation by using positive physical activity, exercise, and positive lifestyle, so that performance, fitness, and health improvement is achieved. Thank you very much.